Good day, everyone. This is an exciting day because we're not having one, but two guest drugs, and I'm going to interview them. They are hydrofluomethazide and methylclothiazide. But first, help me welcome the generic drug hydrofluomethazide.
Hi, Miss Rona. Thank you for inviting me to your morning show. I'm very excited.
How are you, hydrofluomethazide?
I'm doing great. I'm just having a great time in saving many lives of people who are suffering from hypertension.
Wow, that's amazing. So I will now start the interview. Are you ready?
Yes, I'm ready. Bring it on.
Okay, so for the first question, besides your generic name, what are the other names you are known for?
I am manufactured by different pharmaceutical companies. I am known for brand names like Saluron, Diuretics, and Pfizer.
What are your drug classifications?
Well, my therapeutic classification is diuretic antihypertensive agent. I am also pharmacologically classified as thiazide diuretics.
I have heard that drugs are categorized based on their effects on pregnant women. Do you know what your pregnancy category is?
Yes, that is true. I am a drug that has a pregnancy category D.
What is your mechanism of action in the body, or how do you work in the body?
I am a thiazide diuretic which acts as an inhibitor of water reabsorption in the nephron by inhibiting the sodium chloride symporter in the distal convoluted tubule, which is responsible for 5% of total sodium reabsorption. Typically, the sodium chloride symporter acts as a transport mechanism of sodium and chloride from the lumen into the epithelial cell lining in the distal convoluted tubule. The sodium gradient established by sodium-potassium ATPases on the basolateral membrane provides the energy for this to occur. Once the sodium enters the cell, it is transported out into the basolateral interstitium via the sodium-potassium ATPase. This event causes an increase in the interstitium osmolarity, thereby establishing an osmotic gradient for water reabsorption. I effectively reduce the osmotic gradient and water reabsorption throughout the nephron by blocking the sodium chloride symporter.
What is your pharmacokinetics, or how does the body respond to immune?
I am well absorbed in the GI tract after oral administration with onset of action ranging from 1 to 3 hours. I bind in red blood cells and metabolized in the liver. I am primarily excreted in the kidney through urine.
I know what you're indicated for and your contraindications.
I am indicated for hypertension either as the sole therapeutic agent or to enhance the effect of other antihypertensive drugs in the more severe forms of hypertension. I am contraindicated in patients with anuria or hypersensitivity to thiazide diuretics or other sulfonamide derived drugs.
I also heard that you have adverse effects to the body. What are those?
I have local adverse effects on the different systems in the body. I can cause anorexia, gastric irritation, nausea, vomiting, cramping, diarrhea, constipation, jaundice, and pancreatitis for the gastrointestinal system. For the cardiovascular system, I can cause orthostatic hypotension. Sometimes I can cause leukopenia, agranulocytis, thrombocytopenia, and aplastic anemia in the blood system. For the metabolic system, I sometimes cause hyperglycemia, hyperuricemia, and glycosuria. For the integumentary system, I can sometimes cause purpura, photosensitivity, rash, urticaria, necrotizing angiitis, and cutaneous vasculitis. Also, I can cause respiratory distress and anaphylactic reaction in the respiratory system. I can cause fluid and electrolyte imbalances and disturbances in the urinary system. Lastly, I can sometimes cause paresthesia, dizziness, vertigo, headache, and synthopsia in the central nervous system.
What are the nursing responsibilities that nurses do before, during, and after you are administered in the body?
Before administration, the nurse should assess first the client for any condition which could be a caution or contraindication of this drug. History of allergy to any of the preparations, fluid or electrolyte disturbances, gout, glucose tolerance abnormalities, liver disease, systemic lupus erythematosus, pregnancy and breastfeeding. Assess baseline status of the client before administering the therapy to determine any potential adverse effects. Assess skin and lesion to monitor for adverse reaction to the drug and cardiovascular perfusion. Monitor orientation, affect, and reflexes. This is to evaluate the CNS changes that might be related to changes in blood pressure and blood flow. Assess pulse, blood pressure and respiration, and adventitious sound to evaluate blood flow and potential changes in cardiovascular function. Evaluate laboratory tests for bleeding time and liver function to monitor potential adverse effects on the liver. After the assessment, the nurse can now proceed to the diagnosis. Nursing diagnosis related to my application as a drug therapy in the body include the following: disturbed body image related to drug effects and indication, impaired urinary elimination, imbalanced nutrition, less than body requirements related to GI upset and metabolic changes, and lastly, deficient knowledge regarding drug therapy. For the planning phase, the patient will receive the best therapeutic effect from the drug therapy. The patient will have limited adverse effect to the drug therapy. The patient will have an understanding of the drug therapy adverse effects to anticipate and measures to relieve discomfort and improve safety. During the implementation, the nurse should first obtain daily weight and monitor urine output, provide comfort and safety measures, administer the drug with food early in the day. Provide support and reassurance to deal with drug effects and lifestyle changes. Provide teaching on patient regarding the drug name, dosage, warnings to report, daily weighing, and recording dietary changes as needed. After the administration, the nurse should evaluate drug effects such as urinary output, weight changes, status of edema, and blood pressure changes. Monitor patient response to the drug. Monitor for adverse effects such as hypotension, hyperkalemia, hypokalemia, hypocalcemia, hypercalcemia, hyperglycemia, and increased uric acid. Evaluate the effectiveness of teaching plan and monitor the effectiveness of comfort measures and compliance with regimen.
Wow, hydrofluomethylazide. I have learned so many things with this one-on-one interview. Thank you for gracing this show with your presence.
It is my pleasure to be here. Thank you for inviting me. I hope that our viewers too have acquired information that are useful in taking me as a drug regimen.
I am sure that they have acquired useful knowledge about you. Now at this point, we will have another guest. And this is a relative drug to hydrofluomethazide. And it is my pleasure to introduce to you the generic drug Methylclothiazide.
Hello! Thank you for the warm welcome you have given to me in this show, Miss Rana.
So, I have heard that you and hydrofluomethazide are related. Is this true?
I am also therapeutically classified as diuretic antihypertensive agent. My pharmacologic classification is thiazide diuretics, same with hydrofluomethazide.
By the way, what are your other names?
I am known as Enduron and Aquatensin. These are my brand names.
What is your pregnancy category? Is it the same with hydrofluomethazide?
No, my classification is pregnancy category B for pregnant women.
How do you work in the body? What is your mechanism of action?
Diuretics are very important for the treatment of hypertension. We, thiazide diuretics, act by increasing the sodium chloride and water excretion throughout sodium ion transport inhibition across the renal tubular epithelium. Although it is known that thiazides may have more than one action, the inhibition of active chloride reabsorption at the distal portion of the ascending limb, or more likely the early part of distal tube, is a major mechanism responsible for diuresis. It is unknown of how exactly chloride transport is impaired. Thiazide diuretics indirectly increase potassium excretion by the sodium-potassium exchange mechanism by increasing the sodium load at the distal renal tubule. It also decreases the elimination of calcium and uric acid and increase the excretion of bicarbonate. My antihypertensive mechanism is not well understood, although it may be mediated through its action on carbonic anhydrases in the smooth muscle. It is also through the action on the large conductance calcium activate potassium channel, also found in the smooth muscle.
How does the body respond on you? What is your pharmacokinetics?
I am well absorbed in the GI tract after oral administration, with 2 hours of onset of action and peak effects at 6 hours. The duration of diuretic effect is approximately 24 hours. I am distributed in the intracellular space, and I can also cross the placenta, enter the breast milk. However, I do not cross the blood-brain barrier. I am metabolized in the liver and is primarily excreted in the kidney through urine as unchanged drug.
What are your indications and contraindications?
I am used as sole therapy for hypertension or in combination with other antihypertensive medications. I am contraindicated for patients with hypersensitivity to thiazide diuretics. I am cautiously used for patients with fluid or electrolyte imbalances, renal or liver diseases, gout, systemic lupus erythematosus, glucose tolerance abnormalities, and hyperthyroidism.
What are your adverse effects to the body?
I can cause adverse effects in the different systems in the body. I can cause dizziness, vertigo, paresthesia, weakness, headache, drowsiness, and fatigue for the central nervous system, orthostatic hypotension and volume depletion for the cardiovascular system, photosensitivity, rash, purpura, and hives for the integumentary system. For the digestive system, I can cause nausea, anorexia, vomiting, dry mouth, diarrhea, constipation, and jaundice. I can sometimes cause polyuria and nocturia for the urinary system, leukopenia, thrombocytopenia, agranulocytosis, aplastic anemia, and neutropenia. Other adverse effects include muscle cramps, hyperglycemia, hyperuricemia, electrolyte imbalances, and acidosis.
What are the nursing responsibilities that nurses do before, during, and after you are administered in the body?
Before my administration, the nurse should assess for contraindication or cautions, any known allergies to thiazides or sulfonamides to prevent hypersensitivity reactions, fluid or electrolyte disturbances which could be exacerbated by the diuretic or render the diuretic ineffective, gout which reflects an abnormal tubule function and could be worsened by the diuretic or reflect a condition that would render the diuretic ineffective, glucose tolerance abnormalities which may be exacerbated by the glucose elevating effects, liver disease which could alter the liver disease, which could alter the metabolism of the drug, leading to toxic levels, systemic lupus erythematosus, which frequently affects the glomerulus and could be exacerbated by the use of a thiazide or thiazide-like diuretic, hyperparathyroidism, and bipolar disorder, which could be exacerbated due to increased serum concentration of calcium and current status of pregnancy or lactation because of the potential for adverse effects on the fetus or baby. Establish a baseline date by performing physical assessment before starting the therapy. This is to determine the effectiveness of therapy and to evaluate for the occurrence of any adverse effects related to the drug therapy. To provide a baseline reference for drug effectiveness, inspect the skin carefully for signs and symptoms of edema. Note the extent and degree of edema, including evidence of pitting if there is any. Check the turgor of the skin to determine status of hydration. Assess cardiopulmonary status, including blood pressure and pulse, and auscultate heart and lung sounds for abnormalities to evaluate fluid movement and state of hydration and monitor the effects of on the heart and lungs. Obtain an accurate body weight to provide a baseline to monitor fluid balance. Obtain an accurate body weight to provide a baseline to monitor fluid balance. Monitor intake and output and assess voiding patterns to evaluate fluid balance and renal function. Evaluate liver status to determine potential problems in drug metabolism. Monitor the results of laboratory tests, including serum electrolyte levels, especially potassium and calcium, uric acid, and glucose levels to determine the drug's effect, and renal and liver function tests to identify the need for possible dose adjustment and toxic effects. Nursing diagnoses that are related to my application as a drug therapy include the following: risk for deficient fluid volume related to drug effect, impaired urinary elimination related to drug effect, imbalanced nutrition, less than body requirements related to GI upset and metabolic changes, risk for injury related to changes in fluid volume and electrolyte balance secondary to drug effects, deficient knowledge regarding drug therapy. For the planning phase, the nurse should mind that the patient will receive the best therapeutic effect from the drug therapy. The patient will have limited adverse effects to the drug therapy. The patient will have an understanding of the drug therapy adverse effect to anticipate and measures to relieve discomfort and improve safety. During the administration and implementation, the nurse should administer oral drug with food or milk to buffer the drug effect on the stomach lining if GI upset is a problem. Administer IV diuretics slowly to prevent severe changes in fluid and electrolytes. Continuously monitor urinary output, cardiac response, and heart rhythm of patients receiving IV diuretics to monitor for rapid fluid switch and potential electrolyte disturbances leading to cardiac arrhythmia. Switch to the oral form, which is less potent and easier to monitor as soon as possible as appropriate. Administer oral form early in the day so that increased urination will not interfere with sleep. Monitor the dose carefully and reduce the dose of one or both drugs if given with antihypertensive agents. Loss of fluid volume can precipitate hypotension. Monitor the patient response to the drug, such as blood pressure, urinary output, weight, serum electrolytes, hydration, periodic blood glucose monitoring to evaluate the effectiveness of the drug and monitor for adverse effects. Assess weight daily to evaluate fluid balance and check skin turgor to evaluate for possible fluid volume deficit and assess edematous areas for changes, including a decrease in amount or degree of pitting. Provide comfort measures including skincare and nutrition consultation to increase compliance with the drug therapy and decrease the severity of adverse effects, and provide safety measures if dizziness and weakness are a problem to prevent injury. Provide a potassium-rich or low-potassium diet as appropriate to maintain electrolyte balance and replace lost potassium or prevent hyperkalemia. Provide thorough patient teaching, including the name of the drug and dosage prescribed, to enhance patient knowledge about drug therapy and to promote compliance. Additional patient teaching includes the following: importance of taking the diuretic early in the day to avoid interference with sleep, administration of the drug with food or meals if GI upset occurs, need to weigh oneself daily and report any increase in weight of 3 pounds or more in one day. Importance of maintaining an adequate fluid intake to prevent fluid rebound. Need to have readily available access to bathroom facilities after taking the prescribed dose. Signs and symptoms of adverse effects including hypokalemia, hyperkalemia, and hypercalcemia, and the need to notify the healthcare providers should any occur. Danger signs and symptoms to report immediately. Safety measures such as moving slowly if dizziness is an issue and avoiding very hot environments and other situations potentially leading to extra loss of fluid. Dietary sources of food high in potassium with an emphasis on the need for intake of these foods or the need to avoid these foods if using a potassium-sparing diuretic. Need for compliance with therapy to achieve intended results, and importance for continued follow-up and monitoring, including laboratory testing to determine the effectiveness of therapy. After my administration, the nurse has the responsibility to monitor patient response to the drug, such as weight, urinary output, edema changes, and blood pressure. Monitor for adverse effects such as electrolyte imbalance, orthostatic hypotension, rebound edema, hyperglycemia, increased uric acid levels, acid-base disturbances, and dizziness. Monitor the effectiveness of comfort measures and compliance with the regimen. And lastly, evaluate the effectiveness of the teaching plan, such as patient can name drug, dosage, adverse effects to watch for, and specific measures to avoid them.
Thank you for sharing Methylclothiazide, and I hope you guys learned a lot from this video. That's all for this episode. Thank you for watching, guys. Bye!